I work with primary care physicians. When they have patients who are lonely, socially isolated, grieving, or just struggling with life, I'll go talk to the doctor and say, hey, you know, I looked at this patient chart. They look like they're a good candidate for Congregational Care Network. What do you think? And then they'll say, yeah, go in there and talk to them. Matter of fact, they are alone. And yeah, I think Congregational Care Network will be a good fit for them. Trisha is she's our social worker. And Trisha pretty much oversees like all the congregations, and she'll look at, you know, their area code, zip codes, and see where they are, and then try to match them up with a church that's close by.
The chaplains and people within IU Health find people that may benefit from a friend in the community as they leave the hospital setting, and who could keep their ears and their eyes open for somebody who could either use visiting or they could use some resources. And this would be sort of eyes and ears. We weren't really expected to solve problems, but we might be expected to help somebody solve their own problems with some of the resources at IU Health. CCN provided an opportunity for me to participate in my church at Second Presbyterian and connect with a community of people by visiting.
This lady called Deborah called me, and we hit it off real good. I mean, she's really a fantastic talker, and she has a lot of experiences hunting. She still goes hunting. Her and her husband went down quail hunting down in Georgia a couple of months ago, and she brought me back 5 quail.
I didn't have to help him connect to resources, which was interesting. But I'll tell you what I found. He was lonely. Profoundly lonely. His wife died 10 years ago. He is a man that walks 14,000 steps in his home a day.
Yeah, I got a little tour I do. If I watch TV, it's time to start walking. So I just walk back in here, down the kitchen, back where my office is. If I said I didn't get lonely, I'd be lying, but I get lonely once in a while. But I'll come out of it.
In this day and age, I think it's a basic and yet so important thing to connect with people, more than ever. And I also think in my life, I've been lonely a couple of times, and when I lived abroad, and I have to say, I think loneliness is right next door to physical illness. It is a debilitating thing to feel alone. And I think a welcome voice on the phone, I think a little laugh, enjoying a laugh with somebody, it really creates energy for you and for me. I probably get as much out of these visits, and maybe some days more than David does. Well, David and I are lifelong friends now.